Well, hi everyone. Thanks for joining us. This is David again. And today, here we have with us Flannery O'Neill, who is with the Stroke Onward organization. So we got a little bit of introduction here. After experiencing a life-threatening stroke, Deborah Meyerson of Stanford University co-founded Stroke Onward with her husband, Steve Zuckerman. Stroke Onward is a nonprofit on a mission to provide stroke survivors, families, and caregivers with more resources to help them navigate the emotional journey to rebuild their identities and rewarding lives. Today, we have with us Flannery O'Neill, stroke survivor and executive director of Stroke Onward. Hi, Flannery. How are you today?
Doing well. Thanks so much for having us today.
Very good. Well, thanks for joining us today, and tell us a little bit about maybe about yourself and how you got involved with Stroke Onward.
Well, as you mentioned in the introduction, I myself am a stroke survivor. And prior to experiencing my stroke about 4.5 years ago, I had been working in public health and have a master's in public health. So was working at a local public health agency on a broad variety of health topics. And then was at work when I experienced my ischemic stroke
Wow.
that left me unable to speak, with facial palsy, with weakness, and kind of a limp hand on my right side. And so, sought out emergency care and got the
Yeah.
treatment that I needed, but then quickly realized that it was going to take some more time for my speech to come back. And so spent quite a bit of time in speech therapy, recovering and recuperating from that, and have been really fortunate to recover a lot of my speech, although definitely I still notice issues, on a daily basis. But so what brought me then to this work is, as I kind of went down my own emotional healing journey after this traumatic experience of having a stroke,
Yeah.
I really realized that I wanted to take my personal experience plus my professional background and make this an easier path for the people that would come behind me, or
Yeah.
after me with stroke. And that, I think, comes from my public health prevention kind of brain that just is, I know that we can make the system better. And so that's what I have been seeking to do. I've worked with the American Heart Association for a while in the acute care for stroke, and supporting hospitals in implementing clinical guidelines in acute care. And it was at the American Heart Association when I heard about Stroke Onward and the work that Deborah and Steve are really trying to do to impact
Yeah.
the emotional recovery from stroke, because unfortunately that we do a great job of getting speech therapy and physical therapy, occupational therapy to our stroke survivors. And often we don't talk very much about the emotional
Yeah.
component and the emotional healing from stroke. And then,
That's right.
stroke has a variety of different impacts on people's lives, and how that really impacts our identities, and in very dramatic ways. And so how do we rebuild?
Absolutely. Well, thank you so much, Flannery, for sharing that absolutely inspiring story. I think many of our viewers will very much resonate with kind of the struggles that you had gone through. And I want to first off congratulate you with all the progress that you've made so far in your recovery. And I'm sure that today we're kind of speaking here on this show, but it's the result of a lot of hours, perhaps hundreds of hours of hard work and rehabilitation that really kind of brought you to where you are today. And I think that's a testament both to your resolve and your determination. So very much a big congratulations to you for that. And thanks again, of course, for kind of coming back into the community and afterwards devoting your time to uh, raising awareness and creating resources for other stroke survivors. I think there are so many that are in the stroke community that were former stroke survivors, it's really a testament, I think, to how much this disease, stroke and brain injuries in general, can impact someone's life, and also the lack of resources that we have for survivors. That so many people go through this and say, "Hey, you know, there's something wrong with the system. I need to, having gone through this, I need to go back and somehow change the system." So congrats to you for that. And I'm sure that everyone's very much um, uh, kind of thankful for you for your devoting your time to the community. So thank you. And I want to just echo, several of the things that you mentioned, that there's a lack of resources in general, but especially on the emotional side for a lot of stroke survivors. And I think that there's so many factors that brain injury causes, and oftentimes it's very easy to leave behind the mental health and those elements because it's not so visible, and so not so easy to see. I think I was involved in some of the clinical trials with stroke survivors with the Motus hand, and one of the tests that we did, one of the pre-post kind of assessments, was a depression scale. It was the CESD, the Center for Epidemiological Studies, CES, and it was a depression scale. And it was, for me, I had been more familiar with the physical elements, the physical disabilities following stroke. It was eye-opening conducting that questionnaire. It was I think 20 questions with stroke survivors, both pre their treatment and then 3 months later, to see how many depressive symptoms or depressive signals were part of so many stroke survivors' lives and how persistent they were. So very much a kind of a shout out to the work that you guys are doing at Stroke Onward, and thank you for all the awareness and progress that you're bringing. So maybe tell us a little bit about Deborahs Stroke. I understand Deborah was the co-founded the organization with her husband Steve. Maybe tell us a little bit about Deborahs Stroke and what drove her to create this organization. I venture that maybe somewhat similar to both your and many other stroke survivors' experiences.
Yeah, thank you so much for asking about that. So Deborah was a tenured professor at Stanford University in her early 50s when she experienced a severe stroke, and which she also had complete aphasia, and really struggles to this day with pretty severe aphasia, and also some weakness and loss of use of her hand and foot on the right side. So again, that was about 10 years ago. So she really spent the first couple of years of her recovery really focused on she's going to get back to being a professor, and hours and hours and hours, like you said, it's just hundreds of hours of therapy that we put in. And she had about 3 years of time through Stanford University to kind of recover and regain that capability. And unfortunately, she was not able to regain her speech to the level that is needed to become a professor or to maintain her professorship. And so was no longer able to work in the way that she had been building towards in her life and in her career. And for her, that's where her identity crisis started, of who am I and what am I, how do I bring meaning and happiness into my life when the person that I thought I was, I'm not able to do some of those things anymore. And so that's what really brought her to, okay, how do I take my knowledge, because she had been a researcher in identity and had in fact written books about identity prior to her stroke, just in a different context, more of the workplace context than the kind of stroke context. And so she set out then to write a book. and
Okay.
write another book. So she'd written a book before, but this time it was very different because of the impact that aphasia had on her life. She needed a lot of help to write that book. And so there were a couple of people, and it ended up that her book, which is called Identity Theft: Rediscovering Ourselves After Stroke, that's available on, there's a website specifically for the book,
Yeah.
and it's www.identitytheftbook.org. Also available in libraries, and we have it on audiobook. So she, her son is one of her sons is the co-author, Danny, and her husband also significantly helped. I think it was a family endeavor, certainly.
Yeah.
And this book really walks through not only Deborah's story, but also the story of many other survivors, because we know, our, although there are similarities amongst all of our stroke experiences, everyone's is unique, and the
Absolutely.
impacts that the stroke has are certainly unique. And so she felt it was really important to highlight the experiences of other survivors, to really capture kind of what does that process of healing look like, and how do you kind of rebuild your sense of self after stroke. And so publishing that book was really a way
A great
for
step.
Deborah. Yeah,
Yeah.
exactly. And she could keep being in that, in the role of teacher, and student, together, and just in a different way than she
Yeah.
previously did.
Yeah.
And it was through that, working on the book, that she and her husband really realized the gap in resources. And to your point, I mean, there are certainly gaps in resources all across the stroke recovery spectrum. But frequently what we're told, and what I was told after my stroke, is you may experience depression and anxiety. So here are the signs and symptoms of that, but there's a lot more to your emotional recovery
Right.
from stroke, and figuring out kind of what does life look like after a stroke, not only for you as the individual, but for the people around you, your
Yeah.
caregivers. We call them care partners, so that we're kind of in a partnership with one another. But there's just a lot more to it, and so we're endeavoring to build resources to support that.
Yeah. Yeah. And that sense of community, I think that you mentioned, is so important, that for stroke survivors, this is such a foreign concept, that knowing that there are others out there that are going through um, a similar experience, not the same, because like you said, every stroke is unique, but having some of the difficulties, the symptoms, the challenges that each stroke survivor is experiencing, that kind of humanizes it, and makes it that, hey, someone else was able to overcome some of these challenges. I just had my injury. I'm going to work towards that goal as well. And those stories can be so inspiring. And I want to also touch on another point that you made about the caregivers and care partners, about how in Deborah's family, I think her whole family kind of got together and got behind her to support her. And we see that as well with so many families of stroke survivors. And I want to give a shout out to all the caregivers and care partners out there who are, they didn't have the injury, but they are as, are impacted as well. And very much so, their lives changed in now devoting their lives to being a care partner and helping someone kind of through this terrible disease, and this recovery process, and all of the work that they do, the care partners and families that go towards stroke survivors and their recoveries. So I wanted to touch up on that. Well, very very inspiring story from Deborah, and great to hear that she's kind of going from a tenured Stanford professor to having a stroke, and then not being able to return to kind of the job and the life kind of she had set herself on, but then finding this other medium, writing a book, and continuing those intellectual pursuits, both kind of it sounds like learning from other survivors, writing her book, and also trying to kind of get the message out there, and that voice of hers, as a teacher, as a professor, not maybe in the front of a lecture hall, but through the medium of a book. So very, very motivational to hear that she's kind of found her calling as well. I want to also give out a shout out to Dr. Jen Hyung Lee at Stanford, both a personal friend, and a kind of a pioneer in the neuroscience community. She does work using circuits. Oh, she's a professor at neurology, neurosurgery, and bioengineering at Stanford, and doing a lot of circuitry work with the brain. So definitely, certainly a shout out to Dr. Lee, to Jin on all of her pursuits and successes. But we're coming back to Stroke Onward. So tell our community about what kind of work we have, this book, Identity Theft. What is Stroke Onward doing today in the community? What kind of materials can we expect to be seeing in the coming weeks and months?
Yeah, so we are working in three separate kind of tracks that certainly overlap with one another. But number one is exactly what we're doing right now, raising awareness and just having conversation about what does it take for a whole person recovery to stroke. So that is including the physical working on your physical capabilities, your speech, and also your emotional recovery, so that we can have that that full return to, or maybe not return, but as we integrate the challenges that we might have after stroke, that we're caring for our whole person, and making sure that we can be the best, have the best capabilities that we can. So raising awareness, not only in the stroke community, but in the larger population, just to bring awareness to stroke and emotional recovery from stroke. And then in our healthcare, with our healthcare workforce, talking more about what does the emotional recovery look like? What does it look like to rebuild identity, so that as they are caring for their patients, this can be part of the conversation. Beyond just the awareness of depression and anxiety, but just that recognition of this emotional journey that you go on after you are diagnosed and experience stroke. So secondly, we're developing some resources, and one of the resources that we're really excited to be launching at the end of June is a book guide, and we're actually going to be putting out a series of book guides to complement reading or listening to identity theft. So really just to deepen the experience. It provides a couple of different tools. So we'll have chapter summaries, so a much more condensed version of the text, and then just some highlights. So what are the key points in each chapter? And then we've put together reflection questions, so that for each chapter, and this book guide that we'll be launching at the end of the month is going to be specific to survivors with aphasia. Okay. So, and whether this tool is used in a support group setting or with an individual, or like a book club, you have these chapter highlights, these summaries, and then questions. So you can kind of work through, okay, this is what Deborah experienced, or this is what the survivor that was highlighted in this chapter experienced, and how was that for me? And how did I move forward just based on the topic of that chapter?
Absolutely. And with June being Aphasia Awareness Month, I think is very much a very timely resource to put out. Now, and tell us a little bit about, so Deborah has, there's a lot of different ways one can experience aphasia, and kind of delving into this. So tell us a little bit about Deborah's aphasia. She has trouble speaking, maybe.
Yes.
Finding the saying the words, finding the words as well. How is she okay? How is her writing in terms of language?
It's challenging just from the fact that her right hand does not work very well after the stroke. So she does type, but similar to other survivors with the loss of the use of their dominant hand.
Absolutely.
And one thing that I have learned about aphasia, because I did not know much about aphasia beyond my own experience until I started with Stroke Onward. But one of the areas that it can be challenging for people to read. And so that's where we are, Deborah was insistent that there was an audiobook companion to the printed version. And so when we talk about these chapter summaries that we've put together, we are also going to be recording those as well.
Very good.
So that is accessible to our audience and our community, and in a shorter form, so that if reading a whole or listening to a whole chapter is challenging, that we've got it a little easier to digest.
Maybe some bite-sized chunks.
Exactly.
Yeah,
exactly.
Absolutely.
And so these are aphasia materials, and so the chapter summaries and highlights, really it's not specific to the aphasia population, but the questions. So we've tailored our questions specific to the for people with aphasia. We have worded them to talk about living with aphasia, but we are working on tools that would, similar tools for survivors of stroke that don't have aphasia, for care partners. So again, tailoring those questions to meet the kind of the experience of care partners, for healthcare professionals, and then for the general population. So if your book club were to read Deborah's book, just providing some questions to kind of deepen the experience, of.
Well, we'll certainly have to have links to both identity theft, Deborah's book, and these resources as well, along with the show here. Now, I want to talk briefly about kind of again revisit the emotional elements after a stroke. I think there are both there's the stroke affects emotion as well in some cases. In some strokes can very much affect emotion, ranging from mood swings to kind of even personality changes, depending on how and where the stroke is. And I would say that's one side, kind of as a direct impact of stroke. And then of course, stroke can affect other parts of an individual's life. From the physical elements of being semi-paralyzed or paralyzed on one side, hemiparesis, along with perhaps even kind of outside of just the physical elements, that loss of independence can create this socially isolating type of feeling. And I think we all got a small flavor of that, I think, during COVID, during the quarantine. But for stroke survivors, for many stroke survivors who are used to going into their community, working with many others, going to various social events, and then after that being suddenly isolated at home, and depending on their independence for weeks, months, or years afterwards, that can be also a very taxing element on individuals with stroke. So that's, I think, a secondary effect, where there's a primary effect of how emotions are affected, personalities are affected by a stroke, and the secondary effect of just because of the physical change and the loss of independence, how that can impact the social mobility and the ability for someone to interact with the outside world, and that being so isolating can lead to and can cause some depressive symptoms or depressive thoughts. What advice do you have, Flannery, for someone that's just had a stroke and maybe just starting to experience kind of some of this social isolation, where they're not able to see the friends that they used to be able to, and they kind of have to do things over video chat, or on occasion have people visit them?
I think something that has been really valuable for me, and I know for others in the community, is a support group. And finding a group that really fits you. So as a young survivor, I first went to support groups, and there wasn't where I was living when I first had my stroke was in a small community, and there was no support group. And so I I started one and met some fellow survivors that way, and that was really helpful for all of us, to know that you're not alone in this experience, especially when you're living in a rural community. It's really easy to feel pretty isolated
Yeah.
in this experience. We had a small hospital in my town, but it's not, when I went to therapy, I was the only one there. So I didn't have a natural stroke community necessarily. And so
Yeah.
that's where finding that group really helped. And then I've also founded a young survivors support group, really speaking to the specific areas that young survivors, have challenges with. And again, we are a smaller population, young survivors. And so
Sure.
we don't fall into kind of what I would think the general population sees as the age group for stroke. And so it is helpful to know that you're not alone when you're experiencing that at a young age.
Can be a different perspective. Yeah. And I mean, there's so many strokes and brain injuries every year in the US and around the world.
Mm-hmm.
I think about 800,000, according
Yes.
to CDC estimates, strokes in the US alone. And
Mm-hmm.
by some estimates, 1 in 4 adults will experience stroke in their lifetimes. But it's kind of this ironic thing where, as a result of the stroke, you get so isolated, and it doesn't feel like there are others out there that are going through the same thing. But it's because almost in some ways everyone gets kind of isolated from everybody else. And like you said, finding those communities, and bravo to you for taking the impetus to start a support group in your community. But having those support groups, absolutely, I think can have such a tremendous impact. And kind of going back to some of what we talked about earlier, talking to others that are going through similar things, sharing tips, and just this feeling of normal is not the right word, but feeling of that, there are others going through a similar experience, that you're not alone. That can be so positive after a stroke, especially for how sudden they typically are. With some diseases, you kind of get some warning. Oh, you're for something like diabetes, or even a lot of neurological disorders that progress over time. You kind of understand what you're getting into, and while you have some of that social mobility, you're able to kind of prepare yourself and harden yourself in some ways. But for stroke, for so many, it's so sudden that you kind of get thrown into this, and that sense of loneliness can be so that silence can be so loud. So thank you so much for sharing that, and for coming on today to kind of give us some insight into both your experience and Deborah's experience as well with Stroke Onward. Certainly, we support everyone that brings more awareness to the needs of stroke survivors and those with brain injuries, especially with kind of, our view that the treatment of chronic stroke, of chronic brain injury, has been so underdeveloped in the past couple decades relative to the advancements we've made in acute treatment. We're able to save so many more people because we're of these advances in diagnostics and imaging, in clot busters, like with things like TPA. But then kind of we've not really seen those same advancements on the chronic side, where we can save people's lives, but really bringing them back into kind of a quality of life is something that I think, and sure many in the community share, we're lacking both the resource, the technology, and the awareness for. And so thank you so much for all of your and Stroke Onward's efforts in bringing that awareness. And thank you for coming on. To any last parting thoughts today?
I just want to thank you for helping us spread the word. I think that just the awareness is just so critical. So appreciate what you're company is doing to bring access to therapy all across, regardless of urban, rural. Having experienced my stroke in a rural setting, I know firsthand how much that is needed. So just want to thank you for that, and appreciate featuring us as part of the work that you're doing.
Well, thank you so much, Flannery, and thank you for those kind words. I think it takes us all to bring more equanimity and kind of increase access for especially those that are underserved in across the world in the stroke community. Thank you so much, Flannery, for joining us today, and we hope to have you back soon. Thank you.
That's great. Thank you.